Out of the 695 homeless people in Maine, 480 of them are in Portland. We feel as though we are obligated to do something about this, since they most likely came to Portland seeking help. In Portland today, we have two main establishments assisting the homeless: Oxford Street Shelter and the Preble Street Resource Center. The Oxford Street Shelter offers overnight bedding, housing, mental health, physical health, and substance abuse services. The Preble Street Resource Center not only provides shelter during the day, but they provide 3 meals a day, 365 days a year. Branching off from Preble Street is the Florence House, which provides shelter for women, Logan Place, which offers permanent living solutions, and Veterans Housing Service, which assists veterans with housing. The Portland Homeless Prevention Task Force is a small organization that deals with issues that can potentially eliminate the causes of homelessness or even diminish the number of homeless people itself. Today, their primary focus is finding more facilities for housing, but unfortunately, they have concluded meetings for the season.
Although Portland provides many services, they still face many barriers preventing them from making the organization stronger. For instance, we wanted to supply more beds to the homeless, and if we were not able to, we wanted to find out why organizations weren't able to provide more beds. We first connected with Preble Street. At Preble Street, we worked in the soup kitchen and handed out food to the homeless. Preble Street is an amazing organization, but we didn't end up learning any new information. Without Preble Street, our homeless population would fail to meet basic human needs. Preble Street is incredibly important. We want to stress this. But we really felt disconnected from the clients at Preble.
Can you hear us from there?
I just speak up.
Okay, so we were wondering what your goals were for this organization and if you were facing any barriers from achieving that goal right now.
I would say Preble Street has a number of different missions and goals. So the overall is to sort of provide clients just the basics of humanity and to do that in a socially just way. So just making sure people have access to medical care, food, all the things that you and I might take for granted.
Sure.
We're doing so in a way that's not just us tending to people, but treating them like human beings. Treating how I would treat you or you would treat me and giving them that level of respect.
Right.
So that they expect that from others, as well as hopefully to the point when they're not here at Preble Street. That they're in their own apartment, living their own life, so they know sort of what it is to be like everyone else.
Sure.
As for barriers, I'd say there's a lot of barriers. There's never enough money to provide things like that. There's never enough time. There's never enough people. And I'd say sort of just, I think people in general, I think they're very good-natured people who don't necessarily look at our clients in the best light. Not that they look down on them, but clients at Preble Street, they're not projects, they're not pets, they're human beings. So I think well-intentioned people can sometimes be a barrier to that, but I just think we don't have enough help. And I think always having that always makes sense.
Sure, yeah, you guys are always looking for help. I've never had a problem signing up for
Never, we always have something.
So, okay, that's great. Yeah, I think that's all we have, right? Been very helpful, and I think this will be good for a project. So, thank you so much. What's
My
your name?
pleasure. Steve.
Steve, I'm Nathan.
Nice to meet you, Nathan. Thanks for helping out.
After contacting the task force, we were scheduled to work at Oxford Street Shelter. This experience was entirely different than at Preble. Although we worked the same amount of hours, we learned so much about how the homeless really live. We had long conversations with the staff, and they were all really loving towards their clients. They treat the homeless with respect, and they really just want them to get a good night's sleep. We managed to get an interview with the assistant shelter director at Oxford Street. He was incredibly helpful. He gave us insight on our goal and the obstacles they themselves were facing.
Okay, so we were just wondering if you had a plan in place for setting up any more beds, because we heard that you guys always need more beds. So do you have any plans, and if you do, like, what's the number one obstacle you might be facing?
Sure. So the city, as you guys know, we have a long-standing policy that was first enacted by our late city manager from the 80s, who said that if someone presents here in person in need of shelter, we're not going to turn them away. Therefore, we expand to meet the need, which means that we have not only this shelter here on Oxford Street, but we also open overflow facilities. We always have the need for more beds. The issue where it comes down to is that it's really a zoning issue. Okay, so in the city of Portland, there's different zones. There's residential zones, commercial zones, and amazingly, there's a zone specifically designated for shelters. and it basically encompasses the block around this building, another small kind of pocket around Milestone, and I'm not sure if it's been updated on Valley Street for Florence House, but that was a huge kind of labor of love to get Florence House open down there. So there's a zoning issue as well as an economic issue. The city's not going to, I don't think buy a building or anything like that, but we're always searching for all viable options and working really closely, with the Mayor's Task Force and Homelessness, which he put together last year, and really trying to enact some of their sort of recommendations. But nationally, the model is not to build more shelters. The real solution is to build more permanent supportive housing for folks, and that's really what we need to do as a community. More shelters is not, while it'd be nice, don't get me wrong, it is certainly not the solution that we need long term. So we need more places, like the apartments at Florence House and like the places at Logan Place, so that these chronically homeless folks can be successfully housed.
All right, that's a really good point. Yeah, long-term solutions definitely would be better than short-term. Another question we had was just personally, from what you've seen, what do you think might be the number one cause, or maybe a certain variable that many people seem to have for homelessness?
Well, I mean, for us, the number one cause is surely untreated mental health issues and substance abuse. There's always going to be economic issues, folks down in the luck between jobs, foreclosure on their homes, that sort of thing. But the reality is here at Oxford Street, the vast majority of our folks have either substance abuse issues, mental health, usually both. I would say anywhere from 60 to 80% of our folks, depending on which sets of data that you use and how forthcoming people are when we ask those questions. But you guys worked here the other night, and I think just the visible signs of people suffering. The new kind of thing that's happening for us is people with tremendous physical issues. Okay, so people in wheelchairs, walkers, that sort of thing. There's a current generation of 50-something to 60 baby boomers who have been chronically homeless for a long, long time. And that age bracket is actually kind of end-stage life expectancy for people who have been chronically homeless, whereas for a healthy adult, 70 to 80, whatever, for the chronically homeless, it's 50 to 60. So our shelters are slowly morphing almost into like a hospice setting, a lot more really chronic health conditions, cancer, diabetes, heart conditions, and that sort of thing.
So what do you think the solution is to help deal with people that are physically disabled or mentally handicapped or substance abuse? Do you think the permanent housing solution would work with those people too?
Absolutely, it absolutely would. That's a big part of it. And then, to deal with the mental health and substance abuse issues, then you got to get into a whole another can of worms as far as the mental health system and the substance abuse system in our state, which is not where it needs to be. It's just not good enough. It's obvious. On any given night, we're the largest freestanding mental health facility in the entire state of Maine. There's more folks here who have mental health issues in Spring Harbor or even Riverview. Out of our 260 folks that we may have had last night, well over 200 of them have those sorts of issues. So.
Okay.
Yep.
Think we're good? All right.
Overall, we learned so much about how homelessness in Portland really works. Unfortunately, we do not have the time or resources necessary to increase the amount of beds. However, we learned about the obstacles that Portland, as a city, is facing.
We both feel that helping the less fortunate should not be considered tedious. These are real people who live lives just like anyone else. Interacting with these people was incredibly rewarding for both of us. We plan to keep volunteering and helping out whenever we can, and we encourage everyone else to do the same.